Hi, I'm Dr. Daniel Headrick. I'm a family doctor and board certified in addiction medicine. I've been practicing addiction medicine for 30 years, and I decided to semi-retire and focus on healing people's brains that are in recovery for their first 90 days especially. I've found that we've been giving really good treatment to people and their brain is incapable of absorbing it. If we can get their brain more healed faster, they'll respond to these great ways to treat addiction. I think that's one of the reasons why there's a lot of arguments about what really works, because sometimes a lot of different types of treatment work for some people, and is it 12 steps, or is it antidepressants, or is it adventure therapy or equine therapy or sound therapy? They all probably work, but the problem is our population that's getting exposed to it can't absorb it. And so we've developed a way to help the brain heal in a matter of a week or two. They can be at where it would normally take 3 or 4 months. They're more alert, they sleep better, their mood is better, their memory's better, they're capable of learning new things. So this is a real basic chemical, but it's really powerful. People feel the effects in a matter of days. It's IV therapy, and there's a lot of research trying to make that in different forms, but orally it doesn't absorb enough. And it's actually a derivative of niacin, which the founder of AA discovered and promoted the last 5 years of his life. And we've known for a long time scientific evidence that niacin helps people in recovery, especially from alcohol. It helps speed up the clarity and the brain healing and the memory and decrease the craving. So niacin is vitamin B3. It's one of the vitamins. It's completely safe. But niacin has a lot of side effects when you take it orally. The flush feeling, the palpitations. And to take enough of it, you have to have a lot of side effects. So what these other doctors and scientists have discovered probably about 20 years ago, that there's a form of niacin that you can give IV and get large quantities in and bypass the GI tract. So it's called NAD, which stands for nicotinamide adenosine diphosphatide. It's actually what your niacin turns into. Niacin, vitamin B3, gets absorbed through your GI tract and eventually turns into NAD in your cells. It's in every single one of your cells. You have 40 trillion cells, and it's the primary source of energy. It's the source of about 85% of the required energy for all your cells. So what we're doing with the IV therapy is giving every single cell in your body a boost. It will help your skin, your lungs, your heart, your liver, your kidneys, but primarily what's going to really gain the most help is the nervous system. So we're flooding the body full of what it needs to heal itself. That's completely different than trying to heal it for it, like maybe like giving an antibiotic it's doing the body's job. We're not doing that with NAD. We're just supplying the energy for your own body to heal itself. And usually people coming off of drugs need that help, and alcohol especially tears up pretty much every single part of your body. Every organ in your body has been depleted of a lot of different chemicals, and it needs a lot of healing. So it's the first time ever that I've been, in 40 years of practicing medicine, I've been able to actually give a patient something that helps the whole picture, helps the whole body. But you got to remember that this disease affects more than just the body. It's what we're doing now is really speeding up the healing process of the physical part of this disease, but it's an emotional disease and it's a spiritual disease. So we're focusing on the beginning stages to get you physically prepared for this recovery, but it's only the first third. Then you can actually do the emotional homework and go through that, and usually that's even harder. That's something, a little, facing your pain and figuring out what you're running from and what you're numbing with your drug or alcohol. And then there's a spiritual part that NAD doesn't do anything for. It can allow you to get in touch with that easier. But there's a lot of homework to do and a lot of work to do after the NAD. But it gets you in the front door. And through that first 30 days, or actually the first 90 days, it gets you through that time when we lose a lot of patients because they're doing everything right. Eating right, sleeping right, exercising, praying, meditating, doing the steps, getting sponsors, and they're still relapsing because their brain is just on autopilot. The judgment center is not working, the CEO of your brain, the common sense part of your brain is still off balance, and you just relapse, and you don't even think about it. It's not even discussed in your brain. You just spontaneously sort of relapse because your brain chemistry is still off balance. So basically, you're still kind of under the influence of your drug for the first 90 days, and we're trying to change that and cut it down to a week or two. All the clients have had a good experience. I've never seen a bad experience. It's kind of hard to even imagine how a bad experience can happen. And I don't like to take the negative way first, but we're giving you, it's a vitamin. It's in every one of your cells already. So it does take a little bit of time to do it. You have to use the IV therapy, lasts for 6 or 8 hours. You have to go slow because there is some of the niacin effects with the palpitations and flush feeling. But if you take your time, it'll get in. And actually, the most common response that first is verbalized, and usually it's like the second day, people say, I'm having vivid dreams. And these are people that have never had, well, they haven't had dreams for years because all drugs interfere with that REM sleep. And one of the first things they say, it's almost universal, they say vivid dreams. Not just dreams, but vivid dreams. And that's a really good sign because dreaming is a real powerful recharging part. The more you can dream, actually, the better your brain heals. We've known that for a long time. The people that have the most REM sleep in recovery have the best outcomes. It's directly proportional to your success. The more REM sleep, the better outcomes. The second thing is people start to notice that they can read better. They can have conversations better. Their speech is sharper and clearer and flows better. Even their eyesight, when they're reading, people have taken off their reading glasses and don't need them at all or a lot less. The other part that it helps is all your muscles. So including your heart and your blood pressure actually stabilize. You get energy and your blood pressure goes down. But you feel it physically in your muscles. Every muscle in your body needs NAD. And what the scientists are putting numbers on it, they've measured about 15% more physical endurance after a week of NAD. And it goes along with emotional endurance too. You can tackle some painful issues emotionally a lot better. We do the treatment in a medical clinic at Headrick Medical Center. It's like a family practice, and we have different lounge chairs that are comfortable. A lot of people sleep through it, but we have videos and TVs that you can watch, and we do exercises, and sometimes counselors come in and do therapy, or we do somatic healing too while you're hooked up. And so we try to make that time 6 or 7 hours a day productive. And then most people are staying at our residential treatment center, and they're getting some emotional homework and groups and individual therapy. When they leave the clinic, they go to the house and do all the groups because we have a packed schedule of activities there with the sound therapy and acupuncture and Pilates and CBD. And Headrick Medical Center is located in Dana Point on Coast Highway, and there's a nice deli right below it. So we have really good lunches while you're getting treatment. The residential treatment center is in San Juan Capistrano in an unbelievably gorgeous, warm park setting of a house. Huge trees around, a pool and jacuzzi. Great places to just hang out and rest, take a nap under the trees, and there's avocado trees and roses. It's very warm and healing and calming. We are offering this treatment to all of our patients, and it's interesting how our patients that we have in the residential treatment center, it's a 6-bed facility, when one of them gets it, pretty much all the rest of the patients will want it, because they see the difference. People come back in over a 2 or 3 period day, and they're living with them, and they can see that these people are healing, brain healing, a lot faster. But we're actually opening it up for treatment at other facilities, other treatment centers and other residential treatment centers, where it can supplement the other facilities. And they've brought in patients, and we have them for 6 or 7 hours, and then we return them back to the other treatment centers. So they actually can put it on their website that they offer that as part of their treatment. And that works out really well for everybody.